Hello everyone, I'm Phil Diamond, the spokesperson for the U.S. Embassy. I'm here today with Dr. Issa Makumbi. Welcome, Doctor.
Thank you.
We are at the Public Health Emergency Operations Center, here to talk about the work that the Emergency Operations Center does, how the U.S. government has supported the Emergency Operations Center, and how together we are helping with the COVID-19 response. So my first question to you, Dr. Makumbi, is could you tell us a little bit about what the Emergency Operations Center actually does?
Okay, the Emergency Operations Center, what it does really is to collect and receive information and synthesize it for decision makers, so that the decision makers make decision based on evidence collected by this center from the whole country, from the region, and from the globe.
And what is your specific role here at the Emergency Operations Center?
My role really is to see that this Emergency Operations Center is functioning 24/7, and so that it can coordinate all information necessary to do with public emergency or potential public events in this country, so that the decision makers get information to take the necessary appropriate action to respond to those potential or emergency events in this country. Yeah.
And how long has the EOC been in operation?
EOC has started in 2013. CDC through AFINIT has been supporting the operations of this center.
And tell us a little bit about the history, how EOC came to be where it is now, and what role did the U.S. government play in that?
The U.S. government played a very critical role, because in 2013 we had a demonstration project for proof of concept in how we can get real time and respond to promptly to public emergencies in this country. This demonstration project involved the districts and health information systems, which demonstrated that the project outcome had very valuable outcomes which could be replicated in other countries. That was 2013. By 2014, the Global Health Security Agenda was launched in the US, and the US has been supporting this center. They bought all the state-of-art equipment in this center, all the utilities here. And by the way, this is a rented space where we are, CDC through AFINIT paying the rent. So US government really has been very critical and instrumental in starting and still supporting this center. It's functional. We have had over 20 major outbreaks in this country, and they are all being controlled here. What is very, very important for the global community is that this center is protecting the global community from getting these infectious outbreaks, because, as you know, they don't have borders, and the global community has been very, very, very appreciative of this center, because we kind of control the outbreaks at source, so that they don't go outside our borders, apart from this pandemic. Yeah.
When COVID-19 arrived, we were told that the EOC was monitoring 6 simultaneous outbreaks. Can you give us a little bit of insight into what does that actually look like, monitoring 6 outbreaks, and what does that mean for the average Ugandans living here?
So again, that is to protect the Ugandans and, of course, our neighbors, and then the global community at large. Again, to see that the response teams, or what we call the incident management team, and the Ministry of Health senior management, they make sure that we control these outbreaks in time, so that we don't lose so many people, and we don't get many people who are sick of this disease, and sometimes they leave them with debilitating effect on their body. So it means there is a lot of work, but what we do, there are teams which come here. We get teams, what we call incident management teams, which are expert in that area. If it is anthrax, we get an expert. If it is cholera, we get an expert in cholera. If it is Ebola, we get an expert team to come and work here, and we support that team to respond, to make sure that we track the activities, the tasks. We make sure that we coordinate the partners and the stakeholders so that we all have, we all shoot in one goal, so that we have unity of purpose. Yeah.
Now turning to COVID-19, which is really the topic of the day, could you tell us a little bit about the specific role the EOC is playing with COVID-19 and the response in Uganda and throughout the region?
The first thing, what this center did, it was the first entity to inform our senior management that there is a potential infectious disease very similar to SARS. And so this is something which, like a H1N1, that this is something which can come. And there it came, really, it came. So the senior management was informed, and that was very good information. However, this thing found us that we were already responding to the outbreak of Ebola in DRC. So really we were marching already. So when this one came, we just really try to get surge capacity, and we continue responding to this. Now what we are doing, we are collecting all information, both what we call indicate-based and also event-based. That's why we have now so many call centers, because this place, we have over 80 people on call centers, where they get information from the public, and this place was so small, so we have kind of taken it out. We have call centers in MTN, in Airtel, and other sites. So where we get this information and bring it together here and give it to the incident management team, which it uses to inform our senior management on progress, on challenges, on where we are achieving our goals, on where we need to do more to see that we control this disease here. Yeah.
And lastly, are there any messages you would like to share with the public about how we can all prevent the spread of COVID-19?
Yeah, the most important message is really to abide by the regulations as laid down by the President and by the Minister of Health. These are very important things. They are important because we don't have drugs or medicine to cure these diseases. This COVID, we don't have even vaccine. So these measures are so important. They are our savior. If we follow them, we shall control this disease in this country. If we don't, everybody will be affected, and all of us will go down, and some of us will die. So it is important that we follow these guidelines which were given, like social distancing, hand hygiene, coffee etiquette, and so on, so that really everybody is free from this COVID. Because as you know, it is very infectious, and it goes through droplets, and so one can easily get it. Of course, even when touching surfaces where somebody has coughed or sneezed, so that's why we really have to have that hand hygiene is very, very important. And then, of course, social distancing. So the point is, can we really abide by those regulations or guidelines? They really pass to overcome this COVID.
Great. Thank you so much, Dr. Makumbi, for all the important work you are doing and for taking the time to join us today.
Thank you for having me too.